where we do not have to change the course of the intergranulation and the epithelialization phase, but we can continue with the Bonvadis in both the phases, and that seems to be pretty impressive. It is a single continuum of care, and the rate of wound closures where we saw was significantly higher. We've been using Bonvadis for almost about 8 patients in the last 5 to 6 months. I would see it closes faster by about 30 to 40% in compared to the standard of care, which is pretty important in terms of preventing infections and also the patient being on his routine without having to bandage it for longer time of his own or coming to the clinics regularly for the dressings. The patients who haven't had any ischemia, but they have diabetic foot ulcers and the venous ulcers. So for these patients, we have been treating and along with standard offloading techniques. So that's what we have been doing. We're not been using any other form of topical medication, topical dressings other than Bonvadis when we start off on Bonvadis. It's pretty simple for the patients to use it because this is a daily twice kind of an application protocol that we have been using it, and because it's in an ointment or a gel ointment form, it is much easier for the patient to apply on their own. They don't need a clinician intervention or a nurse intervention for them to apply. That is one part of it. And it is also when the dressings are pretty much pain-free. We don't see any discomfort amongst the patients while application or while removing the dressings post Bonvadis. They don't have to come to the hospital or the clinic for every dressing. They can do themselves at home, or the caregivers can do themselves at home. And also the wound closure, the callosities or the hyperkeratosis that happens during the wound closure is much lesser. Probably this is not a part of what we are documenting in the study, but the suppleness of the skin of the closed scar is much better in comparison to the standard of care that we have been following. So hyperkeratosis is lesser, the suppleness of the skin is much better, is the two important aspects that we see apart from the rate of wound closure and the ease of application.